Welcome to our lecture on empowerment theories and nursing. So empowerment is essential to nursing. It is the process of exercising one's own power. It is also the process by which we facilitate the participation of others in decision-making and taking action so they are free to exercise their own power. And so this lecture is going to focus on three different theoretical frameworks or perspectives of empowerment and how they relate to nursing. So starting off with the critical social theories and empowerment. Critical social theories focus on how society controls access to power based on individual characteristics such as skin color, gender, religion, and sexual orientation. The most common critical social theories are critical race theory and feminist theory. These groups, whose freedoms and rights are restricted by socially imposed inequities or inequalities, are known as oppressed groups. Sociologists consider nurses as an oppressed group because of their historical domination by medicine. The traditional healthcare hierarchy that placed medicine at the top may be related to the fact that nursing has been a predominantly female profession, supervised by predominantly male physicians. Gender, class, and status no doubt have contributed to nursing's long-time subordination to medicine. One characteristic of oppressed group behavior is that the group's inability to recognize that powerlessness is socially conditioned, and that can be challenged. Individuals within oppressed groups tend to oppress others that they can dominate. Consider the notion of nurses eating their young or horizontal violence. Although this is a very common phrase, it provides a brief context to this description. Bullying and horizontal violence are oppressed group behaviors. The following literature perspective, which I will post on eClass, provides an example of nursing student oppression and an empowerment. The opposite of oppression is emancipation, and critical social theory examines ways in which social activism can be used to end oppression. Structural empowerment theory postulates that employees of organizations become empowered when they gain access to opportunities, information, resources, and supports through informal and formal power sources. This theory is based on the work of Cantor, who observed that employee attitudes and behaviors were influenced by their access to empowerment structures within their workplaces. Access to opportunity refers to having professional advancement opportunities or opportunities to be involved in organizational activities beyond one's job description. Access to information refers to having the necessary information about aspects of organizational functioning to be effective in the workplace. Access to resources refers to having the resources needed to efficiently and effectively carry out one's work. Access to support involves receiving support to fulfill one's job's responsibilities and engage in relevant decision-making. And formal power comes from an individual's position of formal authority within an organization, and informal power is based on networks and alliances with supervisors, peers, and other contacts within and outside the organization. And we spoke about formal and informal power in week 1. So this is Cantor's theory of structural empowerment theory. And so this is just giving you some ideas of examples of patient empowering nurse behaviors. So access to information would be responding to the patient in clear, understandable terms. Always explain your actions before carrying them out. Access to support is asking patients what you can do for them, offering encouraging remarks for meeting their goals. Access to resources is facilitating community resources and their access to other healthcare team members. Access to opportunity provides patients with opportunities to practice new skills. Informal power is promoting positive, trusting relationships between the patient, their family, and the team. Informal power is refraining from using your formal authority as a nurse, because you do have power, to intimidate or dominate patients' decision making. So the following literature perspective, which I will place on eClass, is an example of how Cantor's structural empowerment theory has been applied to the understandings of nursing care. And so this article provides an excellent overview of important empowerment terms, and it has tables with nurse empowering behaviors and patient empowering behaviors. And I want you to use this article as a learning resource to gain some familiarity and comfort with key empowerment concepts and their applications. And I'm actually going to have you involved in a learning activity as well, whereby I want you to think about a recent clinical experience in which you empowered a patient. What did you do for and/or with the patient and family that was empowering? How did you feel about your own actions in this situation? How did the patient or family respond to your efforts? How does the literature perspective here above help you think differently about your role as a nurse in relation to patient empowerment? So why is this all important for you as a nurse leader? Well, nurses' perceptions of access to organizational empowerment or workplace empowerment, or sometimes I call it structural empowerment, has been associated with numerous positive outcomes such as organizational commitment from nurses, job satisfaction, trust, and low burnout. In one study by a prominent nurse leader, Dr. Heather Lassinger, studied the impact that organizational empowerment structures have on nurses' job satisfaction. And it found that nurses were very satisfied with their jobs. It improved their individual human strengths from within. And for leaders, it's important because it provides leaders with strategies to develop and maintain empowering work environments to ensure job satisfaction. And it's also very important to understand these empowerment strategies to have nurse retention, positive organizational and patient outcomes. So that's the importance of understanding what structural empowerment is all about. It's for your role as a leader. I want to talk about our last theoretical framework for empowerment called psychological empowerment. So psychological empowerment refers to an individual's belief in their empowerment at work. And there's four main dimensions of empowerment. Meaning, which implies a good fit between the individual's work role and their beliefs, values, and behaviors. Impact which is the degree to which an individual can make a significant difference at work, so effect. Self-determination, which is the degree to which an individual has control over what they do at work. And competence, which is an individual's belief that they can perform work activities successfully. So empowerment comes from within, but outside catalysts can spark people's positive beliefs about themselves, such as a good nurse leader. For example, nurse leaders can catalyze nurses' beliefs in themselves, which is psychological empowerment, by providing them with organization empowerment structures. So as I spoke to before, a very strong nurse leader in structural empowerment is Lassinger. And Lassinger found that the quality of nurse to nurse leader relationships and nurse perceptions of access to empowerment structures influence nurses' feelings of psychological empowerment, then in turn enhance their commitment to the organization. And so organizational commitment is closely tied to actual turnover of staff. And this study provided evidence that strong nurse leaders can initiate an empowerment chain reaction among followers, meaning that strong leader-follower relationships lead to an increase in nurse perceptions of structural empowerment, which leads to an increase in feelings of psychological empowerment, which leads to an increase in positive follower outcomes, such as organizational commitment and nurse retention. And so that's why that's important for you to be a strong leader who use structural empowerment as a major strategy which can raise nurses' psychological beliefs in themselves about their capacity to be valued contributors in their workplace. Another area of study from psychological empowerment is looking at empowerment strategies known as leader empowering behaviors. And there are 5 major categories along with examples of each that I'm going to provide to you. So the first one is enhancing meaningfulness of work. And that is inspiring staff to follow the organization's vision and mission through transformational leadership. Fostering participatory decision-making means providing release time for nurses to participate in shared governance councils. Providing autonomy from bureaucratic restraints means eliminating unnecessary policies and procedures and supporting nurses to regularly update evidence-informed protocols. Facilitating goal accomplishment are things like providing educators and professional development opportunities. And expressing confidence in high performance. So that's publicly acknowledging nurses' professional accomplishments and contributions to interprofessional teamwork. So lastly, looking at an empowering professional identity. So nurses' use of power has implications for nursing practice, politics, and policy. Power and professionalism are closely related, and having a strong professional identity is important because a lack of empowering professional identity means that others can step in and decide what nursing is and what nursing can do. And so empowered nurses demonstrate a positive and professional attitude about being a nurse to nursing colleagues, patients and their families, other colleagues in the workplace, the public, and the government. This attitude facilitates the exercise of power among colleagues while educating others about nurses and nursing. A powerful image is important because the impressions we make on people influence the way they view us now and in the future, as well as how they view value in what we do and what we say. So professional identity arises through a socialization process whereby individuals learn the behaviors, attitudes, and values associated with their profession. Professional nursing socialization often begins in nursing programs where students learn about professional standards of practice and codes of ethics. Entry into the workplace can cause a significant clash between learned ideas or ideals and actual nursing practice, and we call this reality shock. And that describes this clash. Another more recent term in the literature is transition shock. And transition shock refers to new nurses' feelings of anxiety and insecurity that may happen after graduation during initial professional adjustment. And so that is why transition programs are one way to ease new graduate nurses' entry to practice. Nursing researchers have identified that, and they've conducted a Canada-wide study of new nurse graduates, and it's called the Starting Out Study, to better understand what work environment factors best support new nurses' transition to practice. And so, as noted above, formal transition programs are important to new nurses. In addition, the researchers found that new nurses do best in environments with adequate staffing, a balance of experienced and new nurses, and a culture that fosters curiosity and continual learning. And so some things to think about as you think about your nurse-led strategies.